Suppose you are doing biochemistry, clinical pathology, serology and hematology general investigations in your lab. Test samples of other investigations you are sending to specialized labs. So you are having tie-up with specialized labs like Thymocare, Heterosolis Lab and Dr. Sol Path Lab. Apart from direct patient, you are also getting test samples from Dr. Galik. Suppose test samples of thyroid panel 1 and thyroid panel 2 you are sending to Thymocare for investigation. In your pathology, rate of thyroid panel 1 is 500 and rate of thyroid panel 2 is 700. In Thymocare, rate of thyroid panel 1 is 300, rate of thyroid panel 2 is 400 for your pathology. End of the month, you need to calculate how much you need to pay to Thymocare, how much you have received from patient for thyroid panel 1 and thyroid panel 2 investigations and how much profit you had. First, you need to register Thymocare specialized lab. Then you need to create rate list for Thymocare. To register Thymocare specialized lab, either click on Add Edit DR Hosp Lab button or click on Hospital DR Lab hyperlink or click on Hospital DR Lab registration submenu of maintenance menu. Suppose you are clicking on Add Edit DR Hosp Lab button. Hospital DR Lab registration form is opened. To register new specialized lab, click on Add New button. Select lab outgoing samples from type drop down list. Select referring from category drop down list. Click on Save button. To create rate list, either click on Add Edit Rate List button or close Hospital DR Lab registration form. Then click on Hospital DR Lab Rate List submenu of maintenance menu. Suppose you are clicking on Add Edit Rate List button. Hospital DR Lab Rate List form is opened. Thyroid panel 1 make charge to 300. Thyroid panel 2 make charge to 400. Click on Save button. Rate list for Thymocare is created. Close Hospital DR Lab Rate List form. Suppose test samples of direct Coombs antiglobulin test and indirect Coombs antiglobulin test you are sending to Heterosolis lab for investigation. In your pathology, rate of direct Coombs antiglobulin test is 100 and rate of indirect Coombs antiglobulin test is 150. In Heterosolis lab, rate of direct Coombs antiglobulin test is 50 and rate of indirect Coombs antiglobulin test is 100 for your pathology. End of the month, you need to calculate how much you need to pay to Heterosolis lab, how much you have received from patient for direct Coombs antiglobulin test and indirect Coombs antiglobulin test investigations, and how much profit you had. First, you need to register Heterosolis specialized lab. Then you need to create rate list for Heterosolis lab. Heterosolis lab is registered. You need to create rate list for Heterosolis lab. Direct Coombs antiglobulin test make charge to 50. Indirect Coombs antiglobulin test make charge to 100. Click on Save button. Rate list for Heterosolis lab is created. Close Hospital DR lab rate list form. Suppose test samples of testosterone and progesterone you are sending to Dr. Sal Path Lab for investigation. In your pathology, rate of testosterone is 300 and rate of progesterone is 300. In Dr. Sal Path Lab, rate of testosterone is 200 and rate of progesterone is 200 for your pathology. End of the month, you need to calculate how much you need to pay to Dr. Sal Path Lab, how much you have received from patient for testosterone and progesterone investigations, and how much profit you had. First, you need to register Dr. Sal Path Lab. Then you need to create rate list for Dr. Sal Path Lab. Dr. Sal Path Lab is registered. You need to create rate list for Dr. Sal Path Lab. Testosterone make charge to 200. progesterone make charge to 200. Click on Save button. Rate list for Dr. Sal Pathlab is created. Close Hospital DR Lab rate list form. In your pathology, some test samples from referring Dr. Galik are also coming. You are charging less for specialized test samples from Dr. Galik. Suppose for specialized test samples from Dr. Galik, rate of thyroid panel 1 is 400. Rate of thyroid panel 2 is 600. Rate of direct Coombs antiglobulin test is 75. Rate of indirect Coombs antiglobulin test is 125. Rate of testosterone is 250. Rate of progesterone is 250. Register Dr. Galik and create a rate list for Dr. Galik. Thyroid panel 1 change charges from 500 to 400. Thyroid panel 2 change charges from 700 to 600. Direct Coombs antiglobulin test change charges from 100 to 75. Indirect Coombs antiglobulin test change charges from 150 to 125. Testosterone change charges from 300 to 250. Progesterone change charges from 300 to 250. Rate list for Dr. Galik is created. Close Hospital DR Lab rate list form. Close Hospital DR Lab registration form. Suppose you need to register direct patient having investigations, blood sugar fasting, blood sugar PP, complete blood count, direct Coombs antiglobulin test and thyroid panel 1. patient is registered, 750 rupees charges is displayed in total amount text box. Here you need to send test sample of thyroid panel 1 to Thymocare, and you need to send test sample of direct Coombs antiglobulin test to Heterosolis lab. To make these entries, click on Send Samples to Specialized Lab button. Samples to Other Lab form is opened. Select Thymocare from Specialized Lab Name drop-down list. Unselect selected title and select Thyroid Panel 1 title. Then click on Add to Following Table button. Thymocare and Thyroid Panel 1 combination has been added in table. Thereafter, select Heterosolis lab from Specialized Lab Name drop-down list. Unselect Thyroid Panel 1 title and select Direct Coombs antiglobulin test title. Then click on Add to Following Table button. Heterosolis lab and Direct Coombs antiglobulin test combination has been added in table. Now click on Save button. Suppose you need to register direct patient having investigations thyroid panel 2 and testosterone. Patient is registered, 1000 rupees charges is displayed in total amount text box. Based on patient's request, you are changing thyroid panel 2 charges to 650 and saving bill. Here you need to send test sample of thyroid panel 2 to Thymocare, and you need to send test sample of testosterone to Dr. Sal Path Lab. To make these entries, click on Send Samples to Specialized Lab button. Samples to Other Lab form is opened. Select Thymocare from Specialized Lab Name drop-down list. Thyroid Panel 2 title is selected. Click on Add to Following Table button. Thymocare and Thyroid Panel 2 combination has been added in table. Thereafter, select Dr. Sal Path Lab from Specialized Lab Name drop-down list. Unselect Thyroid Panel 2 title and select Testosterone title, then click on Add to Following Table button. Dr. Sal Path Lab and testosterone combination has been added in table. Now click on Save button. Suppose Dr. Galik has sent patient test samples for investigations of blood sugar random, urine analysis, thyroid panel 1 and indirect Coombs antiglobulin test. Patient is registered. Instead of 730 rupees, 605 rupees charges is displayed in total amount text box. To save bill, click on Save Quick Bill of Displayed Amount button. Here, you need to send test sample of thyroid panel 1 to Thymocare, and you need to send test sample of indirect Coombs antiglobulin test to Heterosolis lab. To make these entries, click on Send Samples to Specialized Lab button. Samples to Other Lab form is opened. Select Thymocare from Specialized Lab Name drop-down list. Unselect Selected Title and select Thyroid Panel 1 title. Then click on Add to Following Table button. Thymocare and Thyroid Panel 1 combination has been added in table. Thereafter, select Heterosolis lab from Specialized Lab Name drop-down list. Unselect Thyroid Panel 1 title and select Indirect Coombs antiglobulin test title. Then click on Add to Following Table button. Heterosolis lab and indirect Coombs antiglobulin test combination has been added in table. Now click on Save button. Suppose you need to register direct patient having investigations, stool examination and progesterone. Patient is registered. 360 rupees charges is displayed in total amount text box. To save bill, click on Save Quick Bill of Displayed Amount button. Here you need to send test sample of progesterone to Dr. Sal Path Lab. To make this entry, click on send samples to specialized lab button. Samples to other lab form is opened. Select Dr. Sal Path Lab from specialized lab name drop down list. Unselect selected title and select progesterone title. Then click on add to following table button. Dr. Sal Path Lab and progesterone combination has been added in table. Now click on save button. End of the month, you need to calculate total payable amount for specialized labs. To see report of payable calculation for specialized labs, click on specialized lab payment submenu of report menu. In filter window, change from registration date to 1st November 2014. To see payable amount to Thymocare lab, select Thymocare from lab list. Then click on show button. First patient who is registered on 3rd November 2014, you have sent thyroid panel 1 test sample to Thymocare. Based on rate of thyroid panel 1 of Thymocare, you need to pay 300 rupees. Second patient who is registered on 8th November 2014, you have sent thyroid panel 2 test sample to Thymocare. Based on rate of thyroid panel 2 of Thymocare, you need to pay 400 rupees. Third one, patient test sample from Dr. Galik, which is registered on 13th November 2014. You have sent thyroid panel 1 test sample to Thymocare. Based on rate of thyroid panel 1 of Thymocare, you need to pay 300 rupees. For November month, total amount 1000 rupees you need to pay to Thymocare. Close this report. If you want to see how much payment you were receiving from patients and how much profit you gained, then select show patient charges option of filter window and click on show button. First one, direct patient, for which you did not create bill. Based on direct patient rate of thyroid panel 1, your income is 500 rupees. Second one, direct patient, for which based on patient's request you have changed thyroid panel 2 bill amount to 650. Your income is 650 rupees. Third one, patient test sample from Dr. Galik, for which you have created bill also. Based on Dr. Galik rate of thyroid panel 1 and bill charges, your income is 400 rupees. For November month, your total income is 1550 rupees and total profit is 550 rupees from thyroid panel 1 and thyroid panel 2 charges. Close this report. To see payable amount to Heterosolis Lab and charges receiving from patients, select Heterosolis Lab from lab list and click on show button. For first patient, you have sent direct Coombs antiglobulin test sample to Heterosolis Lab. Based on rate of direct Coombs antiglobulin test of Heterosolis Lab, you need to pay 50 rupees. For this direct patient, you did not create bill, but based on direct patient rate of direct Coombs antiglobulin test, your income is 100 rupees. For third patient test sample, you have sent indirect Coombs antiglobulin test sample to Heterosolis Lab. Based on rate of indirect Coombs antiglobulin test of Heterosolis Lab, you need to pay 100 rupees. For this, Dr. Galik's patient test sample, you have created bill also. Based on Dr. Galik rate of indirect Coombs antiglobulin test and bill charges, your income is 125 rupees. For November month, total payable amount to Heterosolis Lab is 150 rupees. Your total income is 225 rupees. Your total profit is 75 rupees from direct Coombs antiglobulin test and indirect Coombs antiglobulin test charges. Close this report. To see payable amount to Dr. Sal Pathlab and charges receiving from patients, select Dr. Sal Pathlab from lab list and click on show button. For second patient, you have sent testosterone test sample to Dr. Sal Pathlab. Based on rate of testosterone of Dr. Sal Pathlab, you need to pay 200 rupees. For this direct patient, you have created bill also. Based on direct patient rate of testosterone and bill charges, your income is 300 rupees. For fourth patient, you have sent progesterone test sample to Dr. Sal Pathlab. Based on rate of progesterone of Dr. Sal Pathlab, you need to pay 200 rupees. For this direct patient, you have created bill also. Based on direct patient rate of progesterone and bill charges, your income is 300 rupees. For November month, total payable amount to Dr. Sal Pathlab is 400 rupees. Your total income is 600 rupees. And your total profit is 200 rupees from testosterone and progesterone charges.